Here's a comment that maybe I'll throw out. Somebody is saying it's kind of obviously feeling that physicians are getting blamed. And this comment says, annoying for physician irresponsibility to be blamed for this crisis. 15 years ago, physicians were being castigated for not adequately responding to their patients' pain, and they were urged to be more generous with prescriptions for opioids. So that, I'm sure, is something that you're hearing a lot, and I'm sure many on the program. Any thoughts on that?
You do get a lot of sense of that. What happened in our state initially was the governor actually directed the Board of Medicine to issue emergency prescribing rules, and that meant they had to be put in place, I think, in 30 or 60 days initially. That got a lot of pushback from the medical community. I mean, look, they were, it's the fifth vital sign. Patients come in, they demand it. I think that there was miseducation, I believe, from the pharmaceuticals that went on for an awful long period of time. One of the things that I've been doing is having people read a book called Dreamland, which talks about the marketing of OxyContin as well as black tar heroin and the linkage there. And when you read that book, I think it's very eye-opening for anybody who reads it, but including doctors. They do feel blamed. I understand why they feel blamed, but nobody's trying to ascribe blame. I think the goal of, for example, our opiate prescribing guidelines and some of the other things we're doing is to get doctors to rethink what they're doing. And I think it's going to take a long time. I mean, this is not a quick fix, but I think over time it'll create a lot of help.
A lot of things contributed to heightened awareness about pain management and to the overprescribing. I think the opportunity now is to fall back on what the evidence shows. And the evidence supports that opioids are dangerous, high risk, they should not be first-line drugs, and all of these points are being expressed through the latest CDC guidelines, which several of your participants have mentioned, which are quoting the latest evidence, and that's really where we need to be turning to change this, and then using a systematic approach through a delivery systems, through communities, to basically embed the right thing to do, the safe thing to do, in our practices.